Extraocular muscles, there are 6, 4 rectus and 2 oblique. Rectus are superior, inferior, medial, lateral, and oblique are superior and inferior. Moving on to the origin and insertion of these 6 muscles. So if we focus on the superior orbital fissure, it is like this. So from here the tendinous ring of Zinn runs, right? This is the tendinous ring of Zinn. So superior rectus takes origin from the superior aspect of the tendinous ring of Zinn, and inferior rectus takes origin from the lower aspect of the tendinous ring of Zinn, and medial takes from the medial aspect of the tendinous ring of Zinn from here, and the lateral takes from the lateral aspect of the tendinous ring of Zinn by actually 2 heads. So this is the this is the tendinous ring of Zinn. From lateral, it is lateral rectus taking origin, and from superior, the superior rectus taking origin, and from inferior aspect taking the inferior rectus muscle, and from the medial aspect the medial rectus takes origin. And here it lies the optic nerve and optic artery. This is the superior orbital fissure, and this is the tendinous ring of Zinn. Now all the 4 muscles got have taken origin. Now moving on to the insertion. All these rectus muscles get inserted into the sclera, exactly around the equator. The superior the superior rectus, this is the orbit, superior, medial, inferior, and this is lateral. The superior get inserted at a distance of 7.7 mm from the limbus. If you consider this as the cornea, so from the 7.7 mm distance it get inserted into the equator, whereas medial it is about 5.5 mm, and in inferior it is 6.5, and lateral it is 6.9 mm. Moving on to the oblique muscles. Oblique, we have got superior and inferior. Superior actually take in origin from the, this is the Zinn, right? The tendinous ring of Zinn. So from the superior and medial aspect of this tendinous ring of Zinn or the optic foramina, the superior oblique takes origin, and it runs forward. From there, after taking origin, it runs forward, and then it passes through the pulley, that is trochlea. Trochlea is actually the if you consider this as orbits, and here lies the nose. So from the anterior aspect of the eye, at a superior medial angle, there lies a pulley. So from there it runs, and it passes through the pulley, and then it get inserted into the sclera, superior and outer aspect of the sclera, just behind the equator. So this is the superior oblique, right? If you look at the inferior oblique takes origin from the orbit part of the maxilla. So this is all the maxilla bone, right? Here the nasal, this is the nasal part of the bone, and here is the maxilla. So from the orbit part of the maxilla it takes origin, and it runs backward and lateral. So this is the medial and this is lateral, so backward and lateral. From here it takes origin and it runs this way and get inserted into the sclera. Within this cavity lies the orbit, right? So this is the superior, comes from behind like this, and it passes through the pulley, that is trochlea, which is lying at the superior medial angle, and then it get inserted into the sclera. Whereas the inferior oblique, it takes origin from the orbital part of the maxilla, and it runs backward and lateral and get inserted into the sclera just behind the equator. So make a point that all the rectus muscle get inserted into the exactly at the equator, in and around equator, but oblique muscles, they get inserted behind the equator. Yeah, now origin insertion is done. Moving on to the nerve supply. What is the nerve supply of this muscle? There are three nerves supplying this muscles. Third, that is oculomotor, and fourth, that is trochlear. If any spelling mistakes, please forgive me. 3, 4 and 6, right? 6 is the abducent. So third is the oculomotor. See, all muscles, there are some exceptions, all muscles are supplied by the third. Remember the mnemonic LR6 SO4. See, SO4 is a superior oblique. See, this is the superior oblique, right? So superior oblique getting innervation from the fourth cranial nerve, that is trochlear, and LR6, right? Lateral rectus. If you focus, this is the lateral rectus, right? Lateral rectus, origin point of the lateral rectus is getting insertion from the abducent nerve. So LR6 SO4. Remaining all oblique. What is the remaining oblique? Is left is inferior oblique. And what are the other rectus muscle? That is superior, medial and inferior rectus muscle. So all these muscles are getting innervation from the oculomotor. Now the innervation is also done. Moving on to the actions. So if we look at the origin insertion of these muscles, so there's something called, this is the eye, this is the cornea, this is the pupil, where the pupil lies here, and here is the fovea. So this is the optic axis, right? Optic axis. So the lateral and the medial rectus get aligned parallel to the optic axis. So they are just parallel. So see here, they runs like this. If we draw a line here, see, they are parallel to the optical axis. So being parallel to this optical axis, they have only one action, that is either abduction or adduction. So medial is for abduction and lateral is for medial is for adduction and lateral is for abduction. So this is done. Whereas the other consider about superior rectus and inferior rectus. Superior rectus comes from behind and get inserted this way here, and inferior rectus just behind, just beneath the same line. So it is making, if you draw like this, it is making an angle of 23 degrees. They both make an angle of 23 degrees with the optical axis. If we consider the superior oblique and inferior oblique, superior oblique, from here it comes like this, it goes to the pulley and get inserted this way, right? Inserted this way. So if we draw a line parallel to the axis, it is making an angle of 51 degrees, and the same way the inferior oblique also, just beneath the superior oblique. So they are making a 51 degree angle. So superior and inferior rectus making an angle of 23 degrees with the optical axis, and superior oblique and inferior oblique making an angle of 51 degrees with the optical axis. So as they are making some angle, they are involved in multiple actions, like multiple movement of the orbit and multiple directions. So they have more than one ocular movement. So if we draw this as the orbit, and if I like this, for just remembering, I just draw like this. Okay, yeah, this is the superior rectus and this is the inferior rectus, and this is the inferior oblique, and this is the superior oblique. Done. And here it is the medial rectus and this is the lateral rectus. Yeah. So it is, the medial rectus is pulling medially, that is adduction, and the lateral rectus pulling away, that is abduction. As I already told you, they align parallel to the optical axis, so they got only one ocular moment. And superior and inferior are making about an angle of 23 degrees, so they got multiple things, right? So it is this way, and this way. So this is adduction, this is depression, and this is extorsion. The eyeball is rotating this way, so it is extorsion. If we look at here, draw like this, and like this. Yeah, so it is superior rectus, right? It is elevation, and it is same as of inferior rectus, that is adduction but intorsion. The eyeball is rotating like this. Previously inferior rectus, the eyeball is rotated this way, which is extorsion, and for superior rectus the eyeball is rotating this way, that is intorsion. And inferior oblique this way, and this way, and here also this way, and this way, right? So here it is abduction, and here also abduction, but here inferior oblique being inferior, it helps in elevation. Being superior oblique, it helps in depression. See this, superior rectus is helping in elevation, inferior rectus helping in depression, but inferior oblique helps in elevation and superior oblique helps in depression. And here it is, see, the eyeball is rotating this way. It is similar to that of superior rectus. See here, superior rectus and superior oblique, they are of the same, that is intorsion. And inferior oblique and inferior rectus, see the arrow mark this way, see here, it is what? Extorsion. So these are the movements. And something to note, that when the eye is fully abducted, so when the eyeball, so this is the nose, this is the eye, right? When the eye is fully abducted this way, comes here, if it is fully it is fully adducted, right? So okay, consider this as like this. Once again I'll draw here. Yeah. When the eye is fully abducted, when the eye is fully abducted, then the superior rectus and inferior rectus helps in the elevation and depression. So when the eye is adducted, then superior oblique and inferior oblique helps in elevation and depression. To make a note of this. And here ends the extraocular muscles.